India has reported a staggering 400,000 new coronavirus infections in just 24 hours, adding to a week-long streak of world record-breaking numbers. To battle the devastating second wave, Saturday should have marked the start of a vaccine rollout for hundreds of millions of over-18s in India. But most states are not taking part because there are not nearly enough vaccines to go around.
These are the lucky ones, waiting in line to be vaccinated and eventually being given their jabs. But plans to begin vaccinating all adults are in disarray. Many states simply don't have any doses to give out.
We are requesting the people of Karnataka, especially those who are above 18 years up to 44 years, to refrain from going to the hospitals thinking that you may be vaccinated.
The companies manufacturing vaccines will not be able to deliver the doses on the 1st of May, so the vaccination drive in Madhya, Pradesh will not begin. We are completely prepared. Our healthcare workers are ready, but we do not have the vaccines. Only around 1 in 10 of India's vast population has had even a first jab. The lack of doses made worse by administrative inefficiencies. Oxygen and medicines are also in short supply. Pharmacies say there has been panic buying and hoarding, and they are restricting supplies, only giving out oxygen cylinders to people who can prove they really need them. Emergency care facilities are being set up. Sports halls, religious sites and catering facilities are being turned into makeshift COVID-19 isolation wards. And the awful task of dealing with the dead goes on. In the capital, Delhi, volunteers put themselves at risk, collecting the bodies of those who've died.
2 days back, I picked up on my own uncle, and he died because we couldn't supply him oxygen. I was working in the mortuary van. I couldn't pick up the call, and the moment I was able to receive the call, he was already passed away. So it's really tough for us.
An international relief effort is underway to help India fight its devastating second wave. But deaths and infections are still rising remorselessly, and with not enough vaccines to go round.
For more, we're joined now by DW's Nimisha Jaiswal. Hello to you, Nimisha. So India was supposed to expand its vaccination program today, but as we heard in the report, there's simply not enough vaccine doses to go around. So what will today's rollout look like?
Well, Mariana, today's rollout is continuing, but it will, in a way, highlight India's systemic issues of inequality, because while the government has technically allowed everybody above 18 to be vaccinated, many states, including Delhi and Maharashtra, 2 of the worst hit states, have said we do not have enough doses. Please do not come out and queue outside vaccination centers. We will let you know when we have doses, hopefully in a few days. Now, the Indian government has allowed states to buy directly from manufacturers, which may well be behind some of these shortages. But in addition, those few people who are getting vaccinated today are getting vaccinated at private hospitals, because the government has also allowed manufacturers to sell to private hospitals, but at a higher price. So those of us getting vaccinated today are those of us who can afford to pay for the vaccine, and this once again will push behind those who cannot afford it.
Now, Nimisha, we do know that India is a major producer of vaccines, and yet it's still struggling to ramp up vaccine production for its own population. What is the reason for that?
Well, Mariana, critics analyze, and many health experts have pointed out, that the Indian government, while being aware of the fact that India is a production hub, may have been too laid back in placing its orders. Some of the biggest orders actually only went out in January, and this caused a funding crunch for these manufacturers. The Serum Institute of India, the manufacturer that's rolling out the Oxford vaccine, came out and made a statement saying we do not have enough funding right now to ramp up production. Since then, of course, the Indian government has placed orders, but they will still need time to ramp up production. There was also criticism of the US for not transferring raw material and reserving it for domestic use. That policy has also been revised. It's also important to note that the Indian government does not admit to a shortage of production capacity. When states have said we do not have enough vaccines, the national government has said you actually do. So there is also a problem of a lack of acknowledgement of the problem at hand.
It's a very difficult situation indeed in India. DW's correspondent Amisha Jaiswal, thank you so much for your reporting.